Hey YouTube, it's Tiffany from Tiffany Switched On. I so apologize. It has been way too long since my one and only video back in May of 2017. I could quite possibly be the worst YouTuber in the history of YouTube. But I did notice that I had a couple of new subscribers in the past couple of weeks. Hi, welcome. And I apologize for being the worst YouTuber ever. Anyway, I really intended to join you all in weekly documenting my journey. However, in reality, once I had the surgery, I was feeling completely overwhelmed and really underqualified to speak to what was going on in my body. And I did try and do a couple of videos, but I was just never comfortable enough with anything to post it. So here we are, 13 months out from surgery. I've gained a bunch of perspective, and I still don't know what's going on with my body a lot of days, but I feel a lot more comfortable about speaking about my experience now. So and if I haven't learned anything else over the past 13 months, I have learned how difficult it is to sit in front of this little camera and share your life experiences and what's going on with your body. So it's made me appreciate all of you that much more. I just feel so blessed to know you all. I really sincerely consider you all friends, and I thank you from the bottom of my heart for getting in front of the camera and sharing your journey week to week. Over the past 13 months, I certainly have been trying to keep up with y'all, and have really appreciated your friendship and your thoughts and your kind words of encouragement. And going forward, I really hope to do some more videos and join you all a little more often to participate. So thank you again. So a little update of the last 13 months. I started this journey on June 1st of 2017. I had the SADI or SIPS or Loop DS surgery with Dr. Scott Gamora at St. Joseph's Healthcare Center in Hamilton, Ontario, Canada. And the first couple of months were pretty rough. I got a urinary tract. It wasn't any complications from the surgery per se. I got a urinary tract infection that was undiagnosed for a couple of days and led to me being kind of super sick, which led to me being super duper dehydrated. And unfortunately, with our way our bodies work, once we get dehydrated, it's just a very slow, painful process, a slow crawl back to feeling human again after that. So it took a good couple of months. I was in the hospital and on IV fluids for a good 2.5 weeks, and then it took another good month after that for me to start really feeling a little more like myself again. So at the time of surgery, I weighed 332 pounds, and I had type 2 diabetes and a long arm's length list of comorbidities that I mentioned in my previous video. So I, was in desperate need of an intervention, and this weight loss surgery, thank the Lord, has been that intervention. So fast forward 13 months. I now am down 130-ish pounds. I weigh about 200, 199, depending on the day. I've been here for about 2 months and getting a little frustrated that the scale's not moving further. I do feel like I've got about 30 more pounds to go before I'm done with losing weight, but I try and keep a little perspective in that yes, I still have 30 pounds to go, but when I look back to where I was a year ago, I'm just a really completely different person. My diabetes is fully in remission. I was taking literally buttloads of insulin back then, and now my A1C and barely controlling my sugars at that time with all of the insulin I was taking. But now I don't take any insulin. I completely control my diabetes with diet and exercise, and my A1C is 5.5, which is actually in the normal range. If I had never had diabetes before and my A1C was 5.5, I wouldn't be diagnosed with diabetes. But because I have had diabetes for such a long time, the doctors won't tell me that I'm completely cured of diabetes, but that my diabetes is in remission. So, and I'm quite happy with that. The arm's length list of comorbidities have kind of also fallen by the wayside, and continue to get better every day as I get stronger. So other perks or other kind of things that I've noted as changes for the better. A year ago, I could barely walk across the living room. I certainly wouldn't make it outside very often for a walk because my back hurt, my knees hurt, my feet hurt. And if I could get past all of that and get outside, I couldn't get past the anxiety of people watching me, of the fear of falling, which is still honestly a little bit of a struggle for me. But I'm working on it big time. And, you know, so nowadays I do 2 kilometers every day, and I need, actually my body craves that. My body craves it. If I don't get it, then I start to hurt again. So, you know, just night and day as far as where I was a year ago and where I am now. Other things since the surgery, along with the little complication with the UTI that I had, that actually brought on a kind of a secondary complication. I did sustain some kidney damage. Again, not anything to do with the surgery. The kidney damage they think or they assume was sustained. I was so dehydrated and having to take pretty strong antibiotics for the UTI. And apparently that is not necessarily a good scenario for your kidneys. So I did sustain some kidney damage, but since then my kidneys have, their function has kind of leveled off and isn't getting any worse. So my nephrologist, who's a kidney specialist, is thinking that I should be good now. I shouldn't have to worry about my kidneys as long as everything kind of stays the way it is. I shouldn't have to worry about my kidneys for, you know, 20-25 years. So I still consider that a win. Other little things, I guess, and I know all of you guys are probably experiencing this too with rapid weight loss. Sometimes your gallbladder can kind of give you trouble, and about a month ago I started to have some major pain in my gallbladder. I actually have an appointment with my weight loss surgeon next week to talk to him. He's going to take my gallbladder out for me. I know some people get their gallbladder taken out when they have their weight loss surgery. I did discuss that with my surgeon ahead of the surgery, but he said that the surgery was kind of like 6 or 7 hours on its own, just with doing the weight loss part. So he didn't really want to take the time to do my gallbladder then. And at that time, it never gave me any issues. So he said, we'll just wait and see what happens after. So now, unfortunately, I do have to get my gallbladder out. Hopefully that'll happen this summer, and we can just get that over with. The other thing that is a win and a complication at once, I guess, is before surgery and a little bit after surgery, I was having to get an injection in my left eye once a month. It was a complication to the diabetes. It was to keep the fluid from pushing my eyeball out, I guess. Anyway, back in March, my eye doctor finally said, nope, everything's cleared up. You don't need to have eye injection anymore, which was music to my ears, because honestly, if you think about poking a needle in your eye, it really isn't pleasant. So, I mean, it didn't hurt, but it wasn't a pleasant experience. So I was so relieved when I didn't have to get that done anymore. But after that, a little bit of blood that was floating around in my eye got trapped under a membrane. So now I have to have some eye surgery to peel back the membrane. Sorry, this is sounding a little graphic. Peel back the membrane, clean up the blood, and then put it back, and then I should be good to go. So my eye surgeon says. Anyway, so that's coming up to hopefully this summer yet. But again, I'm not worried about that at all, and I am still grateful that once that's done, I should have my 20/20 vision back, which you know, as a brittle diabetic for all of those years, it was such a big worry that I would wake up one morning and not be able to see. I had heard of that. So anyway, so those are just kind of a couple of things that are going on with me since the surgery. I did want to ask you guys sorry, and I don't edit. I barely know how to post this on YouTube, so I'm sorry. You're just going to get the full thing with all the ums and the pauses and the little blurps. Sorry. Anyway, so I have been wondering lately if some of my body's reluctance to move downward on the scale has been my sodium intake, and because of the extra worry with my kidneys that I have, sodium is kind of a little more of a worry for me than it might be for other people. But with following the mostly similar to a ketogenic diet, I eat a lot of meat, I eat a lot of cheese, and those are pretty laden with sodium. Red meat anyway, and cheese is just laden with sodium. So I'm wondering if anybody else has noticed that, and if you have any ideas or ways to combat that. I do drink a poop load of water, and sometimes I wonder if it's just water retention from MyFitnessPal tells me I should be getting 2,300 milligrams of sodium a day, and I easily get 4,300 milligrams of sodium a day in my diet. So I'm wondering if sometimes when I get on the scale, if some of that weight is just water from all the sodium that I am retaining water. So anyway, if anyone had any thoughts on that, I'd appreciate your input. And I think I'm just going to leave it there. I don't want to bore you guys with my first video back. Again, love you all so very much. Hope you're having a fabulous weekend. And yeah, we'll leave it there. Have a great weekend, and we'll talk to you soon. Bye.